We have a biofilm of a patient with periodontal disease. So we clearly see the amoeba in the center and Amoeba gingivalis surrounded with many leukocytes with granules inside, moving granules. And there you see the amoeba suctioning, just getting the nucleus from the leukocyte. Now you can see that the granules in this position, granules in the leukocyte are not moving as well as the other ones. So something has happened before the amoeba just got this nucleus by phagocytosis. So you see in the center, almost done the phagocytosis or exonucleophagy of this nucleus from the leukocyte. And see how the lower to the amoeba you see some ghost cell that have lost the nucleus. Here another case, same thing, you see a lot of leukocyte because periodontal disease. Then you have this inflammation. Where you have this inflammation, most of the time, if not all the time, you find those amoeba. So you see the nucleus inside the amoeba. You see the phagocytic part on the upper left, and you see the amoeba getting some food, probably from the cells. Here again, you see in the same patient, you see the amoeba that is clearly getting close to this leukocyte in the center. You see the granules are not moving anymore. So, and here again, same patient, you have two amoeba, one on the lower right with his nucleus, karyosome, and chromatin. Is eating some part, a little tiny area of phagocytic part. So this is periodontal disease, and it is important because most patients, they don't know about this. Most dentists, they don't know about this. Now this patient, you have it's like nursery. It's like you have 1, 2, 3, 4, 5, 6, one little minuta in the center. Amoeba, plenty of them. You see, it's like nursery. So here they go on the right side, lower right, with the uroid formation or something that looks like this uroid part. Here we clearly see the nucleus again. Here again, another patient with this amoeba in the center, just phagocytizing the leukocyte cell. Nucleus of the leukocyte. You see the granules again inside the leukocyte or around this amoeba are not moving anymore, so they just got away, or they just went down the cell by gravity or whatever. But something happened between this relation with the amoeba and the leukocyte. Now after this seemed to be done, there we see a mini cell like this, and then the amoeba start phagocytic exonucleophagy process. So we clearly see suctioning area from this amoeba, and you see on both sides, the upper and lower side. And the lower side, there seem to be 1 or 2 part of a little phagocytic activity. Here again, this one. You've seen it maybe already on internet. This is the amoeba, where we clearly see the amoeba feeding from the nucleus, and you see the envelope of the nucleus. It will be left at the end. So this clearly we see that every time we see amoeba, they always have been nourishing, feeding from nucleus of those leukocytes. Sometimes we've seen them feeding on inside of red cells. Maybe they can get some bacteria, but most of their activity. And when you see those dark area inside the amoeba, just beside the nucleus. You see they just have eaten 1, 2, or 3, or sometimes it goes up to 20 nucleus of leukocyte they've eaten. So we really believe this leaves ghost cell that has all those enzymes that could destroy the fibroblasts and osteoblasts and all these things. Here again, see the amoeba nourishing from the nucleus, upper one, right one in the center right now, just finishing phagocytosis. Lots of spirochetes, of course, bacteria, pathogen bacteria, gingivitis pathogen bacteria may be present. This is clear. White cell leukocyte is clear. Parasite is clear. See how this amoeba is approaching the nucleus of the white cell. It just looks like aggressive predator, I would say, like amoebas is people would say about liver abscess and liver amoebiasis. So this looks very aggressive, what we see here, the amoeba getting to this nucleus of the leukocyte. So this is very typical. Here again, the nursery again with the actinomyces with bacteria, look like brush pattern. This will be further calculus inside the gum, and around those actinomyces filaments, they're very well organized, maybe some ankylonism. Then you see the amoeba nursery. I mean, they just organize and will make future calculus, and then will provoke breakdown of the tissue. Here again, lots of spirochetes. Again, the amoeba with the nucleus, karyosome and chromatin down there. Another case, the amoeba. This is a little accelerated 2 to 3 times for most of them. Here you see the amoeba phagocytizing the nucleus again. On the upper part you see the leukocyte left with this nucleus envelope we can see clearly inside the ghost cell. On the left you see again amoeba feeding, yes, almost done. And this is almost of periodontitis. Sometimes worse with trichomonas, 20% they have trichomonas is worst. So here again, maybe you've already seen those. Those are from Dr. in east part of Paris, and this is 4 feeding in the same time. Now this is health. So all patients with health, they have no white cell. They have almost or no spirochetes, mobile bacteria, no spirochetes, no vibrios, no bacilla, just coccoid bacteria, non-moving coccoid bacteria. Here are some epithelial cells, but most of them are coccoid bacteria and filament with no activity, no motility. So clearly this all the time, this is health. So going from perennial disease and going to health is very easy to do, and is clear on a microscope when you have health now. So this is really clear. No spirochetes, no motility, no white cell, no parasite. So this is health. It's easy to get there.